welcome to the second session of ECG interpretation for nurses. In the first session, we have already discussed about the basic ECG, that's a normal sinus rhythm. Here we go for the abnormal ECGs, that is the tachycardia. So first we will discuss. This is the basic sinus beat, that's a normal sinus rhythm. This we discussed already in the first session. Here we go. These are the 5 steps to diagnose the arrhythmias. First, the rate. You should check the ECG that how much is the rate, whether it is bradycardia below 60 or whether it is tachycardia above 100. Then you will check the rhythm, whether the rhythm is regular or irregular. That means 2 R peaks should be evenly spaced in an ECG. RR interval should be same. Then the P waves, whether the P wave is present or absent, and the relation between P waves and QRS complex. Then we will see whether the QRS is narrow and wide. One simple tip is that all atrial tachycardias, the QRS should be narrow. All ventricular tachycardias, the QRS complex will be wide. This is the difference between atrial and ventricular tachycardias. Here we go. The first one is atrial tachycardia, that is supraventricular tachycardia, something originating above. So above the ventricle is supraventricular tachycardia. The typical heart rate is between 60 to 100 beats per minute. If it is more than 100, that is tachycardia, and it is originating in the above the ventricle, that is supraventricular tachycardia. Supraventricular tachycardia, there is no P wave, there is absent P wave. Rate is always more than 100 and there is no P wave in the ECG. That you should see, check whether the first you will check the rate, how much in an ECG. How to calculate the rate we will discuss in details about another video. Then you will see the rate. The rate means the rhythm. Here is the rhythm. Okay, the rhythm means the 2R, that means 1 R is here, another, that means the QRS complex. So this is the R wave, right? So between the 2 R wave, the interval is same. That means 2 R peaks are evenly spaced in supraventricular tachycardia SVT. So there is no P wave, the RR interval is normal, the rhythm is normal, and there is no P wave. That's called supraventricular tachycardia, and the QRS is narrow in origin. So that's called supraventricular tachycardia. Next is another atrial tachycardia is atrial fibrillation. Here the main thing, the RR interval is not normal. That means the RR interval is not, the 2 R peaks are not evenly spaced. If you see over here, the number of small boxes and the large box, it's not equal, right? Here it is more, if you count, here it is less, here it is more than this one. So this is irregular, the rhythm is irregular, and there is no P wave. There is no P wave and RR interval is abnormal. Abnormal means interval is not normal and it's not evenly spaced, right? So that's called atrial fibrillation. So QRS complex is narrow. Atrial flutter, the main change you can see over here, that there is a sawtooth P waves. 1 P wave, 2 P wave, 3 P wave. See, you can see it's like a saw, right? So sawtoothed P waves over here. This is a fibrillatory wave. It's called atrial flutter. So you can see the sawtoothed patterns of the P wave in the ECG. So that's called atrial flutter. Okay, the 3 atrial tachycardias we already discussed: SVT, AF, atrial flutter, and atrial fibrillation. Here are some of the ventricular tachycardias. The first one is monomorphic ventricular tachycardia. So here if you see, there is no P wave, but there is a QRS complex, but the QRS complexes are very wide, right? But the morphology is same. See, the morphology is same. So it's called monomorphic ventricular tachycardia. Next is polymorphic ventricular tachycardia. That means a different morphology is there. See, if you see here, this morphology of the QRS is up to here it is same. Again it is gone to another morphology. Again here it is different. Okay, that is called polymorphic ventricular tachycardia. Here the QRS complex is, there is no P wave, but the QRS morphology is, some places it is poly, it is multiple, right? So that's called polymorphic ventricular tachycardia. After that, the ventricular fibrillation, that's a cardiac arrest. As everyone knows, ventricular fibrillation is a type of abnormal heart rhythm. During ventricular fibrillation, disorganized heart signals can cause lower heart chambers to twitch, to cure. That means to fibrillate uselessly. That means there is no coordination. It fibrillates like an electric current going inside. That is a disorganized rhythm. There is no P wave, there is no QRS complex. QRS complex, what is there? Abnormally, it cures. That means disorganized waves occurs over here. Okay, the two types, fine VF and coarse VF. Fine VF, if you see that there is a fibrillatory waves are this one, and here is the difference. See the difference between coarse VF and fine VF. Fine VF sometimes we can mistaken as a systole also. A systole is a complete straight line, but in the fine VF you can see the small fibrillatory waves. So ventricular fibrillation is a type of abnormal rhythm. During ventricular fibrillation, disorganized heart signals can cause the lower heart chambers, that is the ventricles, to twitch uselessly. As a result, heart doesn't pump blood to the rest of the body. So these are the atrial tachycardias, common atrial tachycardias and common ventricular tachycardias. The next session we will discuss more about the different types of ECG. So thank you for watching.